Hi guys, it's Dr. Ron Miller here with cashbasedphysiotherapy.org, and today we have a student observer who's coming in and working in the clinic with us, observing and taking notes. And this is Nabil. He did his undergrad studies at University of Central Florida, and now he is a first-year DPT student at Emory University, and he's coming into the clinic and asking questions and learning about cash-based physiotherapy and other options beyond just standard healthcare, and some other options that you'll have as a physiotherapist. So what we're going to do is we're giving him an opportunity to ask 3 questions that a DPT student would ask for a cash-based physiotherapy practice owner. So go ahead.
Thank you, Dr. Miller, for having me and coming to shadow you today. I guess my first question, as a student, I just want to know what was the best advice you were given as a student regarding your future practice outcomes and running a cash-based practice.
Yeah. So I'll answer kind of 2 things there. When I was a student, I found that having a mentor or someone to guide you to get good quick was great for me. I actually had a few mentors who were expert clinicians, and they guided me down the track of being an expert clinician. Anything from thought process to taking certain Con Ed courses. You know, I was blessed that I actually had good mentors that guided me and taught me a lot of stuff. I remember my first job, I'd ask my mentors to stay after work and teach me Mackenzie and teach me some advanced manual therapy techniques. So I was blessed that I had mentors to follow and shadow and learn from and guide me down the path. Now, my advice, if most of you follow me online, my advice for students, DPTs, and new grads is to get good quick. And could be by having mentors, it could be through residencies, it could be through fellowships. But my advice, whether you're going into outpatient orthopedics or even thinking about a cash-based clinic, you have to get good quick. And that's my recommendation. You can't be just an average level therapist or well-versed in all different aspects of PT. One of the things that that really allows you to set yourself up to be successful in a cash-based clinic is being the expert. Whether it's in a niche market or being an expert orthopedist, expert in manual therapy, etc. You have to be the expert. So my recommendation for a new graduate is to get good quick. And then that will, as long as you get better outcomes in standard care, you'll thrive in a cash-based setting.
That's good insight. Take as many notes as I can. My next question is, why do you think a lot of current practicing PTs shy away from a cash-based model?
I think we've done it to ourselves. And I mean this is because we've been relying on physicians for referrals for so long. And the standard care model of healthcare, we were a pawn on a chessboard, and we relied on other people to send us business. And now with healthcare changes coming now to a point, we're just a product of our environment, and we've done it to ourselves. Whether it's just turning into a factory setting, seeing 2 or 3 or 4 patients an hour, relying on passive treatment interventions that don't have good evidence to support their usage, just to increase your billable units. We've done it to ourselves. But in that old model, even the research supports this. That's really a small piece of the big healthcare market of just relying on physicians referring to us, and it's just a small piece of the pie. Now, what we have to do is start thinking with a new mindset. And this goes into personal growth books, business strategies, market analysis, and learning business. But there is actually a whole new market out there that we can tap into and really help people who will best benefit from our services that don't even know about us. So there's a huge untapped market, or I like to use the term blue ocean. If you read a book, there's a great business book called The Blue Ocean Strategy, where a red ocean is an oversaturated market with lots of competition, where in physiotherapy, if you could tap into a blue ocean, untapped market, lots of potential, lots of growth, marketing to the public, in my eyes, is, yes, it's an oversaturated healthcare market, but it's an untapped market in the PT world. Most people aren't marketing to the public. But mindset is definitely one of the biggest limitations. And getting out of that old school mindset of relying on others to get referrals and standard care and the way standard care is going, and creating almost a new opportunity for physical therapy to thrive in, to target patients who will best benefit from physical therapy, to educate the public about the benefits of physical therapy, to show better outcomes than standard health care. And then once you get that mindset or get into that newer mindset model, the potential is endless. And regarding a cash-based clinic, there's a lot of things. Opening a business is easy. Anyone can open up a business. Now, opening a business that is thriving, generating profit, and running a business is hard. And we're not trained that. So that's getting outside of our comfort zone. And a lot of people don't like to be outside of their comfort zone. They don't like to venture out into the unknown, or do things outside of what they know. So a lot of times, to jump into a cash-based setting, being stuck in standard healthcare for years, it's getting, that's not comfortable, it's not easy. So, people run into life, whether it's having children, a family, it's not right for everyone, but there's certain people that I think that given the right time, given the right business education, learning how to sell, learning how to market, learning how to run a business, that many PTs can tap into this new model and thrive in a cash-based clinic. And this kind of goes back to your first question, that as long as you show better outcomes than standard care and deliver it with exceptional customer service, you'll thrive. And then you can add on the business training, the sales training, the marketing to complete your kind of package and run a thriving cash-based clinic. But the biggest limitation is just we're lacking the business mindset and getting outside of your comfort zone. You can go as far as fear of failure. Many people don't achieve things in life because they're scared of failing and they don't like to fail. So what I challenge people in my training is to don't look at failure as, oh, I failed, it's not going to work, and I stop. A failure is a learning experience, and you should be able to learn from it, adjust, make adjustments, learn, make adaptations, and then grow past that and move on to the next problem. Because it's inevitable. You will have problems. I will have problems. Opening a business, you will always have problems. Now, the problem is you can't let that problem or hardship stop you from running your business. You have to overcome that. So the business mindset is the biggest limiting factor I think that we have as a profession in opening a cash-based clinic or getting out of that old model of healthcare and tapping into this new model that I call it.
My last question, which we'll keep brief, obviously I have to treat more patients today, but adding on to the last sentence that you were just speaking on is what keeps you motivated to continue growing your successful cash-based practice?
What keeps me motivated is that I truly feel that myself and my colleague Kathy and my team, we're doing great things in Central Florida, helping a lot of people that have failed standard care and failed other treatment approaches. So when you can keep helping people and really changing someone's life and getting them pain-free or really helping people, it really adds fuel to the fire with the motivation. So being able to help a lot of people and expand my word of mouth and my reputation for my company is great, and that keeps me motivated. On the business side, there's still untapped potential out there. There's still room for my business to grow, and it's kind of like a challenge now where that's the beauty of business. You never stop working. There's always more to do. There's more learning experiences. There's more things to grow. There's more profits to get, more people to help. So running a business is a challenge in itself. And there's always good and bad times, and you're learning from that. So it's like accepting the challenge. So I like the competition. I don't play sports anymore, but running a business is like a competition. It's like a sport. I'm competing against all of my competition. So you get a little competitive edge too with that. That since I don't play sports anymore, that I can still use business as a tool for that. So any other questions at all?
That's it for now.
Perfect. So we wanted to keep this kind of short. We do have patients coming in. We want to go over three questions that a DPT student can ask and share with others. So if you have any questions, please put them in the comment box below. Follow me on catchbasephysicaltherapy.org and follow us on social media. So thank you for your time.